Thanks. My question specifically to the women advocates on the panel. I'm a lawyer here in Western Sydney and I mainly practice in the area of family law. We have seen an increase in cases coming before the court during the pandemic, and in particular those involving domestic violence. How do you see the community and the government supporting these groups of people, and what resources are required?
Amani.
Thank you for that question. I've been involved in the domestic violence advocacy space in Western Sydney primarily, but also on a state level. Since about 2017, I lost my mum, Salwa Haydar, to domestic violence in 2015. My dad was subsequently found guilty of her murder and is serving time in prison now. Through that experience, I sort of witnessed a lot of different facets of the systems that we have to work with, a lot of the ways that victims are marginalised by the system, and a lot of the systemic failures that actually leave women in harm's way. I now sit on the board of Bankstown Women's Health Centre, working primarily with women in the Canterbury-Bankstown area so that they can access health supports, counselling and things like that. And we hear the exact same thing, and COVID has exacerbated the situation. So we've had an increase of about 20 to 30% in women reporting domestic violence to the service. We've had very little increase in support or funding over the years. In fact, the core funding for the Women's Health Services has stayed the same for 45 years. Programs are often funded on a 1 to 3 year basis, and so you start doing something fantastic with your community and you're not even able to measure really the impact of it in such a short-term funding sort of turnover. I think all of these issues, a lot of the advocates and frontline workers in the domestic violence space have expressed time and time again frustration about these things, and the fact that whilst there have been pockets of change here and there, on a systemic level, a lot of things have stayed the same. And I know that the first speech I gave as an advocate in 2017, I could probably copy word for word and read out and still be true right now in terms of the policy issues that were identified then.
Can I just ask you, your family tragedy shapes everything that you do, I think, today. How does it shape the way you think about this moment in time when so many people have been in lockdown, so many people have been stuck in circumstances that perhaps they might normally not have been?
It definitely shapes everything I do. I think my main feeling is concern towards the number of women that we know are in abusive relationships, and the fact that we know that it's an underreported crime, the fact that services face so many different barriers and limitations in terms of what they can do, the slow changes that take place on a legislative level. I think for me, the biggest concern is that the greater public sometimes still doesn't understand the drivers of domestic violence. They want to individualise the crime, they want to blame the victims, they want to derail the conversation in all sorts of directions so that they don't actually have to confront the issue of male violence. So for me, the biggest concern is getting those messages across, making sure that we honour and respect the stories of victims. There will be a vigil at Hyde Park on Wednesday for the International Day for the Elimination of Violence Against Women. I'll be speaking there. You can tune in on your phone, online, and watch and hear their names. We've lost 45 women, I think, the last time I checked the count, to violence this year in Australia.
Amanda?
Wow, that is a very good question. So there is so much going on with domestic violence, and I'd say the number one issue is they've got nowhere to go. So, it's hard enough for them to even access the services that are available because they might get caught doing so. In COVID, Western Sydney Women ran online, toxic relationships, financial literacy type programs, and some women had to quickly turn it off because their partner walked into the room, or there was yelling, and they sent a message later, I'm sorry, I can't do it. So we can't even access them. So when they realise this is all too much, I have to run, I have to pack one bag, grab my kids and leave. They've got nowhere to go. If it wasn't for women's community shelters and communities getting together and funding and advocating government to get as much money as they can, we're so underfunded when it comes to shelters. We need to have an absolute overhaul and a massive investment with shelters, because there's a lot of transitional help out there. So to get them into the workforce and to get them financially literate and things like that's all great. but they can't leave the house. Like, they can't break free from that relationship. And I don't think people understand or take them seriously. Plus, you've got the shame that comes with that. So we need to, and I've noticed probably in the last 6 months due to COVID, the women have been rising up and different organisations working together. But we need to advocate, if anything, one of the largest funded things to come out of the next state or federal budget is shelters.